Welcome back to the Adventures in Business podcast. This is our official episode for the 2023 season. We had a little teaser last week, but this is our first guest of the year, and we are very excited. So this is your host, Amy Zander. I'm here with Lisa. How you doing, Lisa?
I am really excited about our guest today. So I am over the top overjoyed. How are
Yeah,
you, Amy?
I am too. It's a good way to start off the year. We ended last year on a healthy note, and we're going to start off on a healthy note. So let's just get right into it. Who do we have today, Lisa?
So today we have my doctor, my friend, a huge proponent of my health journey team, one of the members, Dr. Adriana Raus. And, I really thought about going through and reading her bio, but the testament of what this woman has done in my life is bigger than the words that can be written on a bio. So, Dr. Rouse, we are so glad you're here. Welcome to our show.
Oh my God, Lisa, thank you so much for all this awesome introduction. You're making me blush, and I hope I'm able to fit the shoes that you are presenting to me. Thank you for inviting me, Amy. I'm very excited to be here, and indeed, it's the best way to start the year in the podcast talking about health and um, what I'm doing in my practice. So I'm a family physician by training. I've been practicing medicine for, I should say, probably almost 15 years now. And I have a private practice in Okemos, Michigan, Family Doc Direct. And it's an interesting practice. It's a different model than what probably other speakers or the people listening to us or watching us is used to, in terms of that it's a membership practice, and the doctor, that's me, it's in your corner as a quarterback, helping you with all the health hurdles and everything that comes in the way of life. And I consider myself not only a physician taking care of the physical health, but also about the health of your mind and your soul. So I'm trying to integrate mindfulness and helping people having the right mindset to become as healthiest as possible for so they could enjoy living, because it's all about making the best out of this life. We don't have a long life. We have um, um, limited amount of time on this earth, and it's our job to do our best to be happy and healthy and enjoy it. So that's what I'm doing. And
So, for our listeners, this is a two-parter. First, share what the membership model, what is that, but then why you chose that specific platform, please.
so I'm doing direct primary care, which means I'm the having a direct relationship with my patients. There is no middleman interaction. There are no insurance agents in between me and my patients. No third parties. I take care of my patients, and they are bringing to me all their health problems. I don't bill insurances in my practice for this reason, because I think it's important to have a direct relationship. And it's a membership practice. My patients are paying a monthly fee that covers all the visits, and they don't have additional surprise bills coming at the end of the visit or at the end of the year, because they have everything up front and it's affordable and predictable, so they know exactly how much it's going to cost them to come in to see the doctor. um, I used to practice in a employed model where I was part of a hospital organization, and I was contracted with insurances. And what I didn't like about that model was I didn't had enough time with my patients deep to go deeper into their issues and understand their background, understand their social economical factors that are contributing to their health or to their um, have sickness more than actually health. And I really wanted, as a primary care physician, I really wanted to focus more on prevention. And I didn't had enough time to talk with them about what they could do, what they could integrate in their daily life to be healthier. So I had to look for a different solution to practice medicine, a different platform. And I found this model of direct primary care that allows me to have long visits with my patients. Um, I'm I'm doing a lot of telemedicine and interactions via text and email in such a way that my patients that are working and they are busy with their lives, they could fit taking care of their health, not in the 9 to 5 traditional business hours. Sometimes they could text me, or email me in the evening, Saturday morning, or things like that, whenever they feel the need to reach to their health expert, or I consider myself a health coach, helping them to be healthier whenever they found the time to address those questions. Um, and so far I'm enjoying it. It's a great model for my patients, and I hope Lisa is taking full advantage of um, being a member of my practice. And I'm trying to integrate more avenues to help them be more engaged and be healthier. um, I in 2 years ago I started looking more into how can I engage my patients more, and I discovered life coaching, and I'm integrating right now life coaching in my practice, trying to engage my patients more and becoming healthier.
So are you acting as the life coach or do you work with another life coach?
I am a life coach.
Okay, perfect. And then when you say you're a family practice, does that mean you treat all ages?
I treat all ages.
Okay. And you have an actual brick and mortar office they come and see
I
you
have
at.
a, yes,
Okay.
brick and mortar office.
Besides the telehealth stuff you do. Okay.
Beside telehealth, I take care. It's a mixed model. I mean, some things I could treat in my office. I have to treat in my office, and I have to examine you and listen to your lungs and heart and check your ears. I have to get you in my office to see that. Um, and if something requires follow up, or quickly check in and see how your things are going, with the new medication, or discussing a blood result or a procedure, then we could do virtual visits. So it's a great combination of meeting people where they are.
Right. So with what you said earlier where people can text you or,
Mhm.
meet with you virtually outside of regular business hours, how are you personally maintaining a work-life balance kind of thing when if your clients have access to you all the time?
Like any business, you have to find your own balance and maintain clear boundaries.
Hmm.
And boundaries doesn't mean that boundaries are more with yourself, like what
Right.
times are you going to decide to answer the messages, and how much time are you going to actually be plugged in the business versus personal time. So it's I pretty much check my messages half hour in the evening, and I don't get a lot of messages during outside of business hours.
Okay.
um, and they like, you just batch, like everything in business, you just batch your tasks, and you have like an hour of answering emails, and
Sure.
a half hour of reviewing labs, and there are those things that you need to maintain to have your balance as a
Right.
business owner and practice owner.
Right. Okay, so do clients text you weird pictures like what is this rash or things like that?
That's not weird. That's actually a very good use of
Yeah.
texting. Yeah,
Right.
and like I sometimes ask them, like, please send me a picture, because a
Okay.
picture says more than 1,000 words. Try to
Sure.
describe a rash. It's
Right.
itchy and it's like swollen.
Right.
It's big, like how big it is.
Right.
And how
Yeah.
red it is. So it's actually very helpful, and it's sometimes it's a simple thing to reassure them, or like saying like, I really need to get you in today, or like this needs to be, do this before I get you in, so I could take care of this problem.
Mhm.
Yeah, there are no weird pictures.
Right.
I
Yeah.
I like more when people are sending me pictures of their pets or their grandkids, or when
Aw.
they're going in vacation, saying like, oh, I saw this beautiful thing and I thought about you and what you said. So
Aw.
different things, different kind of pictures I get um, on my phone,
Yeah.
texted
I
from my patients.
I can imagine that this is amazing for new parents, right? Because I remember those days when my firstborn was little and I didn't know, should I be worried? Is this something that's, and just being able to send a quick message and get a response rather than having to run to the ready care all the time or being worried. That's I wish I would have had that when my kids were little.
And that extends to all ages,
Hmm.
like because some things we need to worry about and some things we could be reassured. Um, and sometimes two lines will make a difference into, should I stop everything, drop everything and run, or I could continue, finish my work, and then, reach back to the doctor or see them in the morning.
Right.
Hmm.
So one of the things, you talked about being this life coach, coming alongside is almost like that next part of helping people on their health journey. When I first met you at a networking event, one of the things that you said that resonated with me, and I'm not even sure if you realize this, is that you put the care in healthcare. And every time that I refer somebody, I'm like, you have to meet Dr. Adriana Raus. She puts the care in healthcare. When did you realize that? What was there an event? Was there something that really happened aside from being able to spend more time with your patients that drove you to that philosophy?
That's a very interesting question, Lisa. I found myself like through my training that there are some things in life that we could change with science and with medicines and with procedures. But one things will not change is how we make people feel. And that's the most important part when we are interacting with people that are sometimes not at their best moment in life and in health. And they know when you care, when you don't care, when you're distracted and you just follow the numbers on the lab results or things like that. And I decided that moment that my patients need to know that I care about them and I care about their well-being. And if I'm not able to help them with science, with medication, I could help them with a good word and, being next to them and being a listening ear. And I have broad shoulders. People could cry on my shoulders. um, so when I was employed and I remember, I'm not sure if I ever told you about this, is I had an elderly lady. She was probably in her late 90s and was middle of the winter. And she called the office that she's very sick and she was worried that she may have the flu. And I told the front desk that I could probably stop by on my way home because she was living close by to my home. And I realized I was told that you cannot go to her home. There is liability that is not covered by your malpractice because you are meant to work in the office and she needs to make an appointment and come in the office. And I realized that doesn't make any sense. She's an elderly woman that I'm afraid for her health and for her well-being to get in the driveway and get in the car or have somebody drive her to my office. So I realized that that's not the model where I actually fit the way I want to care for my patients, because I enjoy doing home visits. I want to see my patients on their environment. And when they are very sick and they cannot come to see me, I have no problem going to see them at their home if possible. So I need to find a way to be able to care for my patients,
Mhm.
even when they are too sick to come in to see me. So yeah, I'm uh, I'm able to do this right now, and I'm very happy with this outcome of my practice.
I love to hear that this is the direction that medicine is going, and that there's more of a need and a demand for this kind of healthcare. Let's take a break real quick and just hear from our sponsor, and we'll be right back with you. So we're here with Dr. Adriana Raus, and we're talking about how she puts the care in healthcare and the way that the healthcare is moving towards a more direct and personal way of caring for our patients. So, Dr. Raus, tell us what you are most excited about this year in your practice or in your life. If you've got some events coming up, what do you got going on?
So I'm very excited about what's going on in my practice. I am gonna implement a program of it's a life coaching, health coaching program for my patients, and it's gonna focus more on mindset regarding um, health issues and health goals. And I want to expand that program to the general population that is not my patient, and I will be able to hopefully reach more people that have their own doctor, but they want to focus more in um, becoming healthier just by, don't want to say weight loss because everybody wants has a weight loss resolution probably for the beginning of the year, but more just to how to implement those healthy habits in their lifestyle in such a way that at the end of 2023 they are happier and healthier.
I love what you said about that, because when we think about, this is the new year for some of you that are listening for as we go along, but a lot of people set that New Year's resolution of losing weight, and oftentimes that's just the number on the scale, right? The weight loss journey or the health journey is more than that. I mean, they're your vital signs. There, I'm preaching to the choir here, but I think really helping people understand healthier choices in different avenues we can choose will help. Are you going to do that as an in-person? Is that going to be a virtual offer? How is that going to work?
That's going to be a virtual offer. I think that way it will be more accessible for a lot of people. And again, meeting them where they are. You could tune in and your lunch break, and I plan to record that and have it available for people to watch it on their evenings or Saturday mornings when they have time. um, I like what you said, Lisa. Like it's not about the resolution. It's about, I like to think about weight loss as the byproduct of self-care. It's not the goal, it's the result. The result is the byproduct of self-care. And when you care about your health so much and you care about your well-being so much, that allows your body to slide to reach the optimal um, weight. And it's not the number on the scale. The number on the scale is just, it's just saying what's the relationship with the gravity that you have at that time.
I like that. Yeah, and I'm of a certain age and demographic where I am fed weight loss ads all the time in my social media
Mm.
feeds and things like that. And because I've been on a more functional medicine health journey
Mhm.
in the last couple of years too, and I've just learn to look at my health differently. It irritates me that that's the only thing they talk about: lose weight, lose weight. And in my experience, when I started eating better and taking care of my body, I lost a lot of inflammation in
Mhm.
my body, which then made me look like I had lost more weight than the scale said that I had lost because of just all that inflammation. I didn't even realize I was carrying around that inflammation, and it was making me look puffy and not feel great. And it just irritates me that these ads don't talk about that.
Well, my goal is to smash the diet culture this year.
Yes, yes. All right. I love that.
Because there are many ways to lose weight. I mean, like if you could lose a leg today, okay, God forbid, and
Mhm.
those are gone like 30 pounds, all right. But do you really want to lose that weight that way? You don't.
Right.
You actually want to be healthier. You want to feel good. You want to feel, I'm looking more at the functional fitness. You want to be that person that carries the groceries one trip and is able to lift the kids or the grandkids and carry them, and you want to be the one that goes 3 flights of stairs without huffing and puffing. So there are many other measurements of vitality and well-being than actually just a number on the scale. And I like to look more at the body composition, like how much muscle you have versus how much adipose tissue. And of course, obesity it's a disease like any other disease, and we have to address it, and we don't want to completely deny it and saying that it's not there or cover it up. But the way we address it is different. And if we are focusing on the journey, okay, not the ultimate the goal as being the weight loss, just the journey, and falling in love with the journey of becoming healthier and taking care of yourself and adding healthier food in your plate, and without losing the enjoyment of eating, and bringing the joy of moving your body into everyday routine. I think those are the ways people are going to have better results and feel better in their body. than if you are just adding one more diet recipe and one more, restriction what you should and you should not do,
Right.
in your life.
In part of the journey, right? You
Hmm.
mentioned very early on that you're looking at preventative, right? You're
Hmm.
looking at doing a preventative measure. And oftentimes, as a business coach, and I even know with my own health journey, it's, oh, there's a problem. Now I need help to fix it.
Hmm.
How do you focus on helping people to see the value in let's do it now and be preventative before it is having to fix a problem?
So, because a lot of people listening to this podcast are business owners, I'm assuming, I want everybody to think that their health is the first number one business that they need to take care of. So, you don't have, yes, you have that company, like Amy, you have this, media production company, but you also have the company of yourself that you need to take care of and invest as much as possible into it, the way you are investing time and energy and effort in your business. Um, it's You need to take care of the foundation.
Mhm.
You need to make sure that you have a plan and you have goals and you have everything, an accountant the same way you have for your regular business. um, if we put this perspective, people realize that, oh, I cannot just neglect, this is serious thing, my health is my business.
You know, I recently heard a story about a solopreneur that had a business and unfortunately got very ill. And because there was nobody to take care of his business, had to close the doors. And I think we don't think about that when things are going well and when things are going right. But even if you are a solopreneur and you have one other person, two other people that don't know what you're doing, one illness can take you out in terms of your business perspective. So absolutely the mindset that it's so important to take
Mhm.
care. You I love how you said you are your first business.
Mm-hmm. It's
And
true.
another thing is, I want to empower my patients and business owners that everything you do every day could contribute to your health. It's not something that there is a magic trick, there is a magic pill that will make you healthier or something, um, you know, um, special about coming to the doctor, more than when what you put in your plate and everything you eat and everything you do or you don't do are influencing your heart, your health. And those are the number one things people need to be aware of, that it's in their power to change the trajectory of their health just by paying a little bit of attention to their activity, the way they live their life, the food that they eat, how much they sleep, and how much water they drink. So there are small things that are contributing to their health long term, and it's not so complicated. We are creating this image of like this is so complicated and it's so hard, and you need to have special equipment. No, you just need to follow the very simple basics. It's simple. Living a good life, it's simple. We just need to follow very simple basics, things.
So if you were to give our listeners one piece of advice, right? What is one best piece of advice that you would like to offer? What would that be?
Don't wait. Start today. Whatever your goal is, start today. There is no better time than right now to take care of your health, take care of your business, to work on your goals, no matter what they will be. If it's a health goal, I hope it's a health goal, or a business goal, or you have a dream. Don't wait. Life is too short. Start now.
Excellent. And for our listeners, let them know how they can get a hold of you or find out more about what you do and the health seminars that you're going to be putting out in this year.
So the easiest is to follow my website, which is familydocdirect.com. And I have an wait list right now for new patients. But if somebody wants to send me a message, they could do that easily right there. And I keep all my messages, and I could add people to the list if they're more interested in about my services.
Great. And just for our listeners, I'll reiterate that. The website is familydocdirect.com, and we will have links to those things and Dr. Rouse's email and all of that good stuff in our show notes for this episode as well.
So there's one last question. If I can ask you one last question, please. Because you said, like you said, most of our listeners are business owners. And when I think about you went to school to be a doctor, and then you became this amazing businesswoman. What what was the most difficult thing about transitioning that thought of being a doctor and being a business owner, and how did you overcome it?
That's a very good question, Lisa.
Mm-hmm.
So this is, I, as a medical professional, I love learning, and this was a different challenge about learning a new skill, the skill of running a business, opening a business, and the most important sentence I accumulated, I gained during this transition was I belong. I belong in business community the same way I belong in the medical community. And took me a while to believe it and embrace it. But I knew that it's possible. Anything you put your mind into, it's possible. And everything is learnable. So just have to have a goal and aim it. And I'm sure you talk with your clients about this every time, Lisa, but don't let anybody tell you don't belong.
I love that.
I do too. Yep. Everybody belongs at the table.
They
And
sure
if
do.
not, we're going to make another table just for us.
Yeah. And that table is going to be covered in healthy food.
Well, we could talk about this other time.
Yeah.
But so oftentimes I run into entrepreneurs that have a great idea, whether they're a doctor or they're a plumber. They have a great idea, they have a great skill, and they run with it. And that having to stay learning based and know the business practices and to know that they belong at the table, they just have to make sure that it's set properly for them to succeed. Because I have watched you over the years continue to grow and add more value to what your offer is to the community. And I think that's phenomenal. So thank you for sharing that.
Thank you. And thank you so much for inviting me here. I'm really enjoying being part of this project.
Oh, yeah. We're very excited that you were on our show and you are our first guest for the new year. That's perfect. Everybody can start off with some new health goals, and hopefully they'll check out your website and see what you have going on. And we'll be following to see what other great information and health tips that you're going to be putting out there to the community. So thank you again so much for being on our show.
Thank you for inviting me, and thank you, Lisa, for making this happen.
I was so glad when I saw your name come across the registration, because we talked about it a little bit before, but you know what? When people are ready, they'll sign on. So it's been such a pleasure to have a space where you can tell your amazing story, because I know you're impacting lives, and regardless if there's a wait list or there's things that people can learn from you via the webinars and the programs that you're going to offer, please, listeners, take advantage.
Yep. Check out Dr. Adriana Raus at Family Doc Direct. Thank you so much for being on our show. If you would like to be a guest on Adventures in Business, it's very easy. You just go to zediamedia.com, click on the tab for the podcast, and there's a calendar to show up. We record every Wednesday at 11. And we also release new episodes every Wednesday. You can find them on iTunes, Stitcher, or wherever you get your podcasts, or you can also listen to them at zediamedia.com. We hope to see you in 2023 and find out all the amazing things that you're doing. This is a labor of love for us for the 517, and we want to meet more of you and find out more about what you're doing. So we hope you have a great day. Thank you for listening. And as always, go out and make it an adventure.
Very good.